For our prototypical anxiety disorder, we're going to start by discussing the diagnostic criteria for a specific phobia. So a specific phobia at its core is characterized by a marked fear of a specific object or situation. And we can classify specific phobias based on the type of phobic object or phobic situation. So types of specific phobias include animal phobias, for example, a fear of dogs. They include natural or environmental phobias, so for example, that might be a fear of water. They also include something called blood injection injury phobias. These are really interesting and we'll be discussing them later. So these are phobias related to exposure to blood or medical procedures. And a really interesting thing about blood injection injury phobias is that the characteristic emotional and behavioral response is the opposite of what we see with most other phobias. So with most phobias and most fear responses, our characteristic physiological response, we're going to see increased heart rate, increased blood pressure. We're going to see a lot of that fight or flight tensing. With blood injection injury phobias, our characteristic physiological response, we actually see a drop in heart rate and a drop in blood pressure, and the characteristic behavioral response is fainting. So we're going to come back to this later because it's an interesting way to look at a behaviorist model of thinking about phobias. Thinking about other types of phobias, we can also have situational phobias. So for example, fear of being in enclosed spaces. And we also just have a catch-all category for other phobias. So you can see that about 5% of the population meets criteria for animal-related phobias, about 6% for phobias related to features of the natural environment, about 4% for blood injection injury phobias, 5% for situational phobias, and 1% for other types of phobias. So the thing that ties these specific phobias together is this marked fear of a specific object or situation. So what do we mean by a marked fear of a specific object or situation? Well, one characteristic of this marked fear is that this is a consistent fear response. So the phobic stimulus almost always provokes immediate fear or anxiety. So this is not something that an individual occasionally experiences when faced with their phobic object, but that consistently, every time the individual is exposed to the thing that they are afraid of, they experience an immediate and intense fear or anxiety response. Another characteristic of this marked fear is that it leads to changes in behavior. So either the phobic stimulus is actively avoided, or if the individual is not able to actively avoid the phobic object, they endure the exposure to the phobic stimulus with intense anxiety or distress. For example, an individual with a driving phobia may not be able to completely avoid driving, but when they are forced to drive, they may experience intense fear as a result of having to do so. Another characteristic of this marked fear response is that the fear or anxiety that an individual experiences when exposed to their phobic object is disproportionate to the actual danger posed by the phobic object and to the sociocultural context. So many things that people have specific phobias of are associated with some degree of danger. For example, dogs could bite someone and that could cause physical harm, and snakes could be venomous and that could be poisonous. But an individual's fear or anxiety response, if it is disproportionate to the actual danger posed by the phobic object, so for example, if someone has a very intense fear of snakes to the point that they fear going outside because they might see a snake, or because they fear being exposed to a small snake that they know is safe, would be evidence of a disproportionate fear that is excessive compared to the actual level of danger posed by that phobic object. And then finally, for specific phobias, we have a duration criterion. So the symptoms of the phobia need to be present for at least 6 months. And like most disorders in the DSM, the symptoms need to be associated with significant distress or impairment. So either the person needs to be very bothered by the symptoms of their phobia, or it needs to be causing some level of impairment or dysfunction, for example, preventing them from going places, impairing their abilities at work or at school, or impairing their ability to function in some kind of important domain.